Hello everyone, welcome to Hope Worldwide. Today's topic is about basic concept of genetic counseling. As we know that counseling is a process of problem solving established between the counselor and the counselee. Likewise, genetic counseling is a type of counseling offered in the field of medical genetics. It is more focused on providing information on genetic disorders, genetic services, including treatment facilities which are available for genetic disorders. So basically genetic counseling is classified into two. One is prospective genetic counseling and other one is retrospective genetic counseling. Okay. When you look at prospective genetic counseling, it's a type of counseling given to the family members or parents or relatives before the occurrence of genetic disorders in the family. For example, if you are anticipating any kind of genetic disorders in the family, we provide this kind of counseling. For example, like cancer or any kind of genetic disorders like sickle cell anemia or thalassemia, etc. Okay. So come to the other one is about retrospective genetic counseling. It is all about providing counseling services to the parents or family members after the occurrence of genetic disorders in the family, right? So if a child is born with Down syndrome, so we counsel the parents, or mother has undergone spontaneous abortion or a miscarriage, okay? So we do provide counseling to the mother and the family members. That's about retrospective genetic counseling. Okay. If you look at the principles of genetic counseling, as we know that counseling is very professional and very intimate process that we establish with the client, right? So we need to follow all the psychosocial principles in genetic counseling also. So like principle of dignity, principle of active listening, principle of non-judgmental approach, okay, principle of multiculturalism or transcultural approach, that's very important. And usually we follow principle of non-directive approach in genetic counseling. Then apart from that, you need to focus on other aspects of genetic counseling like ethical aspects, taking informed consent, or principle of confidentiality, and principle of explanation or clarification, principle of follow-up, okay. So principle of documentation, that is a vital part of genetic counseling. And also principle of reporting is important, because whatever document you are collecting from the client, it has to be communicated with the respective team members or respective healthcare team. So that is also very important, okay. So now if you look at a genetic counseling, how do it differ from psychosocial counseling is about, here we need to have more expertise in order to understand, identify the occurrence of genetic disorders, especially the pattern of inheritance, okay. So here as genetic counselor, we need to focus on pedigree analysis or family tree analysis, okay, or a family history collection is much mandatory here as part of genetic counseling, because in concept of genetics we believe that as closer the relationship, the higher the chance of transmission or inheritance of genetic disorders, okay. So that's the concept we believe. So assessing pattern of inheritance is very important in genetic counseling, okay. Then history collection also include marital history. We need to rule out any history of consanguine marriage, right? Then obstetric history, because BOH, like bad obstetrical history, or any kind of genetic disorders in the family, right? So that and all are very important, or it is essential as part of genetic counseling, okay. So when you look at the steps in genetic counseling, a genetic counselor has to focus on several steps. For example, number one is rapport building, like as I told you about multiculturalism. When you establish rapport with the client, we need to respect their culture, and we need to talk to them in a very understanding way, and also we need to respect their values and belief system, okay. And second thing is about next is about diagnosis phase, okay. And here we need to be very much clear about the diagnosis, and we need to know how to explain it to the client, okay. Then the next is about intervention. So here we are assisting the couple, as I have mentioned before, it is non-directive approach. You are assisting the couple or the family members to take the decision by means of providing them entire data, or what is that, information about the services which are available, so that it helps them to seek the services from a sophisticated resource center, right. Then the next is about assisting phase. You are assisting them, in fact that's about the intervention phase only. Then very important thing is referral phase, because if facilities are not available in your center as a genetic counselor, you need to know what are the different facilities available and you need to refer them to the sophisticated center. Okay, then which is very important is the final step is what follow up phase. Okay, as genetic counselor we need to at least have telephonic follow up with the clients in order to make sure that they take up the treatment available, or they utilize the services which have been instructed by the counselors or advised by the healthcare team. Okay, this is how we need to follow different phases in or the steps in genetic counseling. Okay, and all other steps or aspects of genetic counseling will be discussed by the next video. Thanks for watching. Bye bye.